guys! Today I thought I would sit down and talk to you about a service in Australia called Medicare, because occasionally people get sick while travelling, and if you're on a working holiday in Australia, I highly advise you to get yourself onto the Medicare scheme to save you money if you are poorly whilst out there. So what Medicare is essentially a government healthcare system which is similar to a system in the UK which is known as the NHS, which people from various countries are probably fairly familiar with. And it allows people of certain countries around the world to receive free or subsidised healthcare if they're unwell whilst over in Australia. These countries have something which is known as a reciprocal healthcare agreement. So basically, if you get sick while in Australia, you get free or subsidised healthcare, and if an Australian resident gets sick in the reciprocal country, they are offered a similar service. Now, I'm not going to go into detail as to every single country which is or isn't eligible for Medicare, but I will pop a link down in the description box below to the Medicare website, which can tell you which countries are eligible and if there's any other things that you need about if you're a resident of certain countries to do to enable you to actually get a Medicare card. I found my old Medicare card for you. I kept it specifically for this purpose because I knew I was going to do a video on it, and I'm going to show you the pretty little thing. So that there is the Medicare card that I was issued when I went to Australia. I had to go to a Medicare office in Perth to receive it. There's offices all around Australia. In any of the major cities, there's usually at least one Medicare office. And I do suggest that it's one of the first things you do when you get there, along with like setting up a bank account and everything like that. Go and get your Medicare card, because if you are sick or you have an accident or something and you're from a country that does have a reciprocal healthcare agreement but you haven't yet got your card, you will be charged for any healthcare. So make sure you get this pretty much as soon as you get there if you can. To get the card, like I said, all you do is go to the Medicare office. You will need your passport and, if possible, a printout of your visa confirmation as well. And what they will do is issue you like a temporary Medicare number. It is just a piece of paper, guys. It literally, I was just like, oh, brilliant, let's hope I don't need it or lose it. And my suggestion with this is just keep it with your passport, in your passport. And then they post out to you a plastic card like that, so that you've got something a bit more substantial, and that comes usually quite quickly. But make sure if you're applying in one place that you're staying there for long enough to receive that card in the post. If for any reason you can't get a Medicare card, perhaps your country isn't part of the reciprocal healthcare agreement, then you can still receive healthcare in Australia, but you will be charged for it, which is why having health insurance is always a good idea. And even if you can get Medicare, you still need health insurance for reasons that I'm going to explain in a moment. If you turn up in an emergency department in a public hospital and you don't have your Medicare card with you, or you haven't yet applied, even though you're from a country that is eligible for the scheme, you will be charged for any care, consultations, prescriptions that you receive. Now, if you are unwell whilst you're on your working holiday in Australia and you have managed to get yourself the Medicare card and you need to visit a doctor, what you need to look for is a doctor that offers something called bulk billing. And I'm not going to go into major detail about it because I don't understand it fully, but essentially you want to go to a surgery that offers bulk billing for a doctor's practice. You turn up with your Medicare card. It's a good idea to also take your passport and any insurance documents just in case. You show them the card to prove that you're able to get the subsidised treatment and free consultation, and they will book you in with the next available doctor. Now, normally you can't pre-book appointments with bulk billing, so it is kind of just turn up and hope you get a good doctor, which with the level of healthcare in Australia, I'm sure you will. You then get your free consultation, and if you're prescribed any medications, you'll be able to get those at a subsidised rate because you've got the Medicare card. Now, if for some reason you're somewhere where there isn't a doctor's that offers bulk billing, you can still be seen. You can show your card, but you will be charged for the consultation and any further costs. But because you have the card and you're part of the scheme, you will be able to claim a proportion back from a doctor's that doesn't offer bulk billing, but you're going to have that initial payout and all the hassle of getting only part of it back. If you have to go to a hospital, Medicare only covers public hospitals, so make sure you get to a public one and not a private one. And if you're treated and have to stay in a public hospital, that healthcare is free as long as you're under the Medicare scheme. So why do I say that you need travel insurance if you're eligible for Medicare? That's because there are things that aren't covered under Medicare, so things could add up fairly quickly if you're unwell or you need emergency treatment. And some of the things that aren't covered include any dental treatment or care, certain services such as physiotherapy, chiropractic services, psychology services or podiatry, that none of those are covered under the scheme. If you need an ambulance, and this is the main reason I say get travel insurance, if you need an ambulance in Australia, Medicare does not cover it. You will be charged a hefty fee to be taken to the hospital. So that is why insurance is so important, even if you are eligible for the scheme. Make sure that you have your travel insurance. And the other thing that it doesn't cover is anything sort of ophthalmological. So no glasses or contact lenses will be dealt with. So to summarise, head down to the website linked down below, check if you are from a country that has the reciprocal agreement. Once you get to Australia, find out on that website where your nearest Medicare office is and get yourself down there with your passport and visa so you can get your card. If you end up having to use the doctors or go to the hospital, always take with you your Medicare card, your passport, a copy of your visa and your travel insurance documents. They are the basic things that you're going to be asked for, and have that travel insurance in place because Medicare doesn't cover everything. I hope this has helped. It's something that I didn't know a huge amount about before I left, so I think it is quite an interesting and useful topic to talk about in terms of working holidays in Australia. If you have got any questions, as always, let me know down there. I will do my very best to answer them. I'm not an expert, but I'll do the bestest I can. If you want more from me, you can head over to my blog, Facebook, Twitter, Instagram, and I am trying to sort stuff out on Pinterest as well. So if you want to head over and look at my pins, you can have a little look-see on there. Until next time, guys, much love, take care, bye! So there's loads of like jargon in terms of money stuff that will be different to your home country. And the first thing that when you go to buy something in a shop or pay for your hostel that you're going to come across is that cash or EFTPOS? EFTPOS, what the hell is EFTPOS? EFTPOS